All right, so we're going to continue talking about the encounter, what's happening during the encounter. And so we're going to discuss some protocols. Your book gives you some very good definitions for protocols. The first one is on page 85, and it says that a protocol is a procedure or system of rules, and that protocols can help to guide the conduct of professionals. And one of the ways that I prefer that you think about protocols and the purpose of the protocols in healthcare interpreting is that it establishes the rules that guide your practice as a professional. It's also going to be something that's going to separate trained interpreters from untrained interpreters. Usually this is one of the things that makes it clear whether a person who is interpreting is trained or not. The protocols are established based on research and based on practice, and knowing what the best approach or the best way of performing interpreting is and how to get the best results. So we're going to talk about some of those protocols that you are going to have to learn how to do. You're going to have to learn how to apply them, how to modify them if it's necessary. And I say that because sometimes we will have to modify them. Now, we're not only going to learn what the protocols are and how to apply them, but we also, very importantly, need to know why these rules or these protocols were put in place. Now, if you look at my slide here, the first slide says, or the first picture says, rules are meant to be broken. And I'm not necessarily saying that rules are meant to be broken, but what I am saying is that sometimes the protocols that we are used to will not fit the situation. And so that's why it's important to know what the main purpose of the protocol is, so that we understand, or that we use our critical thinking skills to be able to get that same result, to get to that same goal, although it might look different than we are used to. And so if you look at the second picture here, it says that you should know the rules well so you can break them effectively. So you need to understand the rules well enough, the purpose of the rules, and then if you need to break them effectively, which means that, okay, maybe I'm not following this rule in the way that it was written or in the typical way that I'm used to seeing it, but even though I'm not following this specific rule to the letter, I'm still responsible for the ultimate purpose of the rule, and so I have to shift the way that I'm doing things in order to be sure that I still meet that goal. When we're looking at protocols, we're going to start by looking at positioning during this recording. We're going to also look at direct speech, which your book talks about in page 95, and then we are going to look at the pre-session. And the pre-session is something that is very helpful because the purpose of the pre-session, as your book calls it, the professional introduction, is to introduce yourself to the other parties in the encounter, the patient and the provider. And then with that introduction, you're also communicating not only who you are, but also what you do and how you will do it. Now, I love using the pre-session with students because right now, as new students, you may not know it well enough. You may not know what you do and how you do it well enough. Most of us come into an interpreting course or an interpreting program understanding that we need to be bilingual and that we need to communicate what one person says in one language into another. But a lot of times we don't know, or we're not aware of all of the things that ensure our accuracy. We sometimes don't understand the level of accuracy that is required in order to do this job professionally. And again, because we are professionals, and it's not enough to be bilingual, there are established protocols and rules that have been established because we know that if we follow these rules, the interpretation will be the most accurate and delivered in the best way in the specific environment where we are interpreting, in our case, in healthcare. So we'll take a look at the pre-session in, yes, a way that it is described by your book as a professional introduction, but also it's going to help us as interpreters give us a general view of what we do and how we do it. Let's start with positioning. So positioning, the goal, so the rule I'm going to explain to you, and your book does also explain to you on section 2.2, page 93, where to stand, where the rule is, where the protocol says that you need to stand in order to promote direct communication. Now we're going to learn about the position, and we're going to discover or take a look at what the recommended position is while you are interpreting in healthcare. But first, again, we need to understand why this rule exists, what the goal of the rule exists, because as we will see in the next few slides, sometimes it needs to be broken. So the reason why we have a specific recommendation as to where an interpreter stands is because we are trying to support direct communication. And so when we decide where an interpreter is going to stand during an encounter, what we're looking for is the least obtrusive position. So we are looking for the interpreter to be as much as possible in the background and not part of the conversation, not a participant in a conversation. So we want to be as unobtrusive as possible. And then the other reason we take positioning into consideration, have to be thoughtful as to where an interpreter is going to sit or stand, is because we want to choose a position that promotes direct communication between the patient and the provider. So now that we know that that is the rule, we are going to take a look at some of the positions that are possible and the optimal one, and what is going to determine where you stand or sit. So in your book on page 93, you will see that there are 4 different positions listed. And position 4, which is beside but slightly behind the patient, is the position that is most often preferred in the U.S. medical setting. And the reason for it is because if you are on the side of the patient, it is seen as a position that supports the patient and makes the patient feel more comfortable. Also, it makes the patient not feel outnumbered. Now, you're also slightly behind, and the goal of that is to have the patient be in front and closest to the provider, so that then that is going to guide them to look at each other and not you, the interpreter. So again, to support direct communication. So you can take a look at the other positions that are in your book. So in the same slide, we can see position 3, which is near the provider, so standing just behind the provider. So instead of beside and slightly behind the patient, now we are beside and slightly behind the provider. However, in the book, you will see that it does mention that there are some benefits to this position in certain situations, One of the examples it mentions is if the patient keeps turning to you, so that you are standing in the preferred position, which is slightly behind the patient and to the side, and the patient sort of keeps turning to you every time you speak or every time they speak. In that case, the goal of this rule is not being met, right? So the goal of direct communication is not being met because the patient is sort of redirecting their attention to you. And direct communication is not happening. As a matter of fact, it's actually being hurt by the patient sort of looking over to you and not looking at the patient, at the provider. So you might want to switch to this third position, which is going to then, if the patient insists on looking your way when you're speaking or they are speaking, then if you are over by the provider, it's going to take their eyes over to where the provider is as well. You're going to take their eyes or their eyesight with you. As we move along, we'll look at other situations in which that position of being on the side of the provider is going to be either optimal or the only choice. But before we do that, you can look at the other positions that are in your book and see position 1, which is away from everyone. So this position, you kind of see the interpreter off somewhere else. It's not obtrusive, so it is unobtrusive, but it might make it difficult for everyone to hear you and might be distracting as well. The other position is a triangle position where the interpreter is in the middle, and that is sort of obvious where if the interpreter is in the middle or between the patient and the provider, then the attention is sort of focused on the interpreter, and again, that's not what we want. That's not going to help the goal of remaining unobtrusive or supporting direct communication between the patient and the provider. So again, the optimal in the perfect scenario, in the perfect situation, the best position is going to be beside the patient and slightly behind them. Now, I want to say that that's the optimal, yes, and that's going to be the position that you should choose when possible. And many times it is possible. But there are other things that we need to consider that may affect where we stand or sit, where we position ourselves. So situations where you have more than one provider because of room, or you have more than one family member that is accompanying the patient. So if you have more than one family member that is accompanying the patient, in that situation, again, for room, you may have to move to the side of the provider. If the patient, for example, is a child, or the patient is sort of surrounded by that family, then you can't say, excuse me, family, you need to move because the interpreter needs to be next to the patient, right? So again, that would be obtrusive, right? And that would take away a bit of autonomy even. So in those situations, what you want to do to remain unobtrusive is to choose another position. In this case, the best position that I would recommend, if possible, is to stand next to the provider. If you have too many folks and you can't make it to a position that allows you to be next to the patient. Another thing that you should consider is patients that have contagious diseases for your own safety. And then also other things that might affect safety, for example, interpreting for someone who is known to be violent, someone who is confused and might think that they are in danger. In those situations, or in any situation where you perceive that it's not optimal for your safety to be next to the patient, you're going to shift positions to one of the other ones that we saw. And another thing that you should also consider when you are deciding where you are going to sit or stand is patient privacy. So this is going to require that you take into consideration the type of examination that the patient is going to receive from their provider, what position they are required to be in, as well as the patient's gender. So I have several pictures here. You see, for example, this first picture where you have a woman who is receiving a mammogram. So in this case, she is going to not have a top on. Her breasts are going to be exposed. And again, so for privacy, we would not stand right next to them, right? We would stand a bit farther away behind her so that we are respecting the fact that she does not have a top on. We will have to remember that because we're not as close as we would be maybe in a regular conversation, our voice needs to be heard, and so we might have to speak a little louder. This other picture shows a patient that is receiving a manual breast exam from her provider, and that's something that's very typical during a physical exam for women. This other picture shows a woman who is possibly getting ready to receive a pap smear or pelvic exam. So definitely in this situation, we don't want to be in a place where we are clearly able to see her in this position. One of the things that you can do, so we mentioned standing further back in the other situations, another thing that you might be able to do is face the wall as this is happening. And then also if there are if there's a curtain in the room, you might close that curtain, or the provider might close that curtain, and you'll have to interpret through the curtain. And again, remembering that you have to elevate your voice to be sure that you are heard. And then this last picture is of a gentleman who is receiving a prostate exam, a digital rectal exam, which means that the doctor is going to insert a finger into the rectum to see if they can feel the prostate. That's a way to check for an enlarged prostate. Again, that's something that is going to be very personal and very invasive to any patient. Regardless of the fact that you've had it done before or not, it's a very private, invasive thing to have done, and so we want to be respectful. Now, when we are doing this, we need to be sure, again, that with our behavior and with our demeanor, we show that we are professionals. We're doing it out of respect. We are giving your privacy out of respect to you, not necessarily because we can't handle it and we don't want to see what's going on, but it's more out of respect. We are healthcare workers. We are used to human anatomy, but our behavior has to be such that when we turn around or step back or interpret through a curtain or face the wall, our demeanor needs to sort of convey that the reason we are doing that is to be respectful. So we are doing this for the sake of the patient, not for our sake. That was positioning. Now let's take a look at the next protocol, which is using direct speech, and that information you should have gone over on page 95 as you read the chapter. And so you will read in your book that the reason that we use direct speech is to support patient and provider relationships and access to one another. Using the first person is the main way in which we employ direct speech. And the first person means that when we are interpreting, we are going to interpret everything as the person has said it. We are going to interpret it using I, using the first person. So the example that your book gives you is, if the patient says, I have a headache, you are going to interpret, I have a headache. You're not going to say, she says she has a headache, right? So that's using the first person. Now, when you are using the first person as you interpret, you're going to use it for both the patient and the provider. So if the provider were to say, can you please sit on the table? You're not going to say to the patient, the doctor is asking if you could please sit on the table. You're just going to say, sit on the table, just as a doctor said it. Aside from mimicking or being closer to direct communication, the communication that someone would have without the presence of an interpreter, using the first person is also faster. It's also easier to interpret. It allows for better accuracy. And we know that interpreting in the first person leads to fewer changes in the message, so fewer errors. It is simpler sentence structure than interpreting in the third person. He said, if you could please, and she said. So it's much easier to say it as we have heard it. And the conjugation is easier because we are saying it exactly in the way that we hear it. It also helps take the interpreter out of the picture, right? It sort of gives you that feeling of, if you're constantly saying he said, she said, then clearly there's another person there. Whereas if you use the first person, then that person within the speech is sort of taken outside or taken out of the picture. And so when you're not having to change sentence structure, when you are not having to have that additional he said, she said aspect in the language, that allows you to focus on the message instead of more on the conjugation. With direct speech, the purpose is to foster communication as much as possible between the patient and the provider. And so here in this green box here that I took from your textbook, you will see that it also should be supported by eye contact. And so your book tells you that you should not make eye contact with the speakers during an encounter. And again, that's a protocol, that's a rule. The purpose for that rule is so that the two other parties are looking directly to one another. It does mention and it does acknowledge that that might be difficult for some of us, especially if we come from a culture where it is disrespectful to not look at someone as you are speaking to them. And so it does give you a little bit of a tip and says that you can look at your notepad if you feel uncomfortable. And that's just sort of a tip to help you redirect the eye contact. Now, we learned in the previous module that gestures and body language carry meaning, as do facial expressions. So we don't want to miss any of that information. So the advice that your book gives you is that you do look at the speakers as they're speaking to catch those facial expressions, gestures, and so forth. But if someone looks at you or turns their gaze to you, then you're going to look at your notepad and then wait for them to look away and then resume sort of looking at them so that you can catch that non-verbal communication. And your book also mentions that there are a few exceptions where using the first person is not necessarily the best situation, where it actually is not conducive to accurate or complete or unobtrusive communication. And some of those examples include interpreting for children. In certain languages, it just does not make sense. In an emergency situation, sometimes it might not be the best where there's some confusion, and if it's causing more confusion, then we want to avoid that. And then when you interpret for several people, such as family members, you may not be able to keep the first person as clearly as you would, because you would have to let the listener know who said what. So for example, if the doctor says, we can wait for surgery until your son is older than 3 months or weighs more than 32 pounds, or we can do the surgery now. Do you have any other questions? Mom says, yes, I want to know what you think is best. And then right after, without giving you a chance to interpret, Dad adds another question and says, what are the risks of waiting for him to be over 3 months? And so in that case, the way that you would interpret that is you would say, Mom is asking, I want to know what you think in order to make a decision. And Dad has asked, what are the risks associated with waiting until he's older than 3 months? And so that way, if you were to use the first person, it would sound like one person has said both of those things. So in breaking away from the first person, you can make it clear to the listener, in this case the provider, who said what. And then the last point there, it says when you interpret horrific content such as rape or torture. And we will talk about self-care later on. Basically, the reason for this exception is in order to protect yourself from internalizing horrific content when you are interpreting for a victim of something that was very tragic, that was violent, that might affect you personally because of the severity. In that case, it might be okay to change from the first person to the third person to protect yourself in order to be able to continue interpreting in the most accurate way, which again, that is the point, right? So the rule is interpret in the first person. The reason why we want to interpret in the first person is because it helps with accuracy, it's easier to interpret, and it's better for direct communication. But if the interpreter is interpreting something so severe and horrific that it is causing her to have a difficult time interpreting, and it is causing her to have issues with accuracy, then in that case, that rule is no longer doing what it's supposed to do, and so you can step away from it and use the third person. Okay, I'm going to stop here, and then in the next recording, we will discuss the pre-session, which is the final protocol that I had listed in the first slide.